Resuming debate, the honourable member for Calgary Confederation.
Well, thank you, Mr. Speaker. Mr. Speaker, I do rise today to contribute to the debate on Bill C-45, which proposes to legalize recreational marijuana use here in Canada. The medicinal use of marijuana in Canada is, of course, already permitted when prescribed by a doctor, and I do support that measure. However, what we are considering here today is the recreational use of marijuana, using drugs for fun. The Health Committee, which I serve on, Mr. Speaker, heard back in September from over 100 witnesses from all across Canada and from all parts of the world. And they presented their thoughts and their concerns on a number of issues related to the legalization of marijuana. And we did hear from many who literally called marijuana a miracle drug, a miracle antidote for relieving and in some cases eliminating conditions such as epileptic seizures, migraine headaches, post-traumatic stress disorder, anxiety, depression, arthritis. I can go on. The testimony from these individuals, it was heartening, Mr. Speaker. Even hearing about the option for physicians to be able to prescribe marijuana instead of opioids such as Oxycontin and fentanyl for treating chronic pain is enough to convince many that medicinal marijuana has a place in our society. However, Mr. Speaker, Canada is now on the verge of normalizing recreational marijuana use, and we have heard a number of serious concerns from a variety of stakeholders. Just a couple of weeks ago, I spoke at length on Bill C-46 and the issue of drug-impaired driving. So I won't reiterate what I had said back then, but I will say that drug-impaired driving is of deep concern to many, and we heard it day in and day out in committee. But I will focus on a couple of other serious concerns. As we've heard many times, there are many studies that show that marijuana does have a negative impact on the developing brain. The Canadian Medical Association, which represents 83,000 physicians in Canada, they came to committee and they said, existing evidence on marijuana points to the importance of protecting the brain during its development. Since that development is only finalized at about 25 years of age, this would be an ideal minimum age based on currently accepted scientific evidence. And just last month, Mr. Speaker, at the World Psychiatric Association's World Congress in Berlin, the community was presented with further evidence that marijuana use by youth can facilitate the onset of schizophrenia and other psychosis conditions in certain people. Complications may include cognitive impairment, social isolation, and even suicide. Mr. Speaker, these are the doctors that are talking. These are the physicians and the scientists and the healthcare providers that are saying this. The reality is that not all our youth are aware of this body of scientific research, and so they are not making informed decisions when it comes to marijuana drug use, and that has to change. It is imperative that we inform our young people that using this drug, marijuana, will likely have serious, permanent, and negative effects on their brain and their mental health. Without question, the largest single concern that we heard in committee, in Health Committee, is that this Liberal government's complete failure to properly execute a public education campaign. In just 8 months, we will most likely have marijuana for sale as a fun recreational drug. Isn't that great? Witnesses testified that if we are going to achieve the primary results that we want, and that is to reduce marijuana use and lower youth consumption, then we need to educate Canadians well in advance of the proposed July 1st, 2018 legalization timeline set by this Liberal government. Unfortunately, there has been no real education campaign started by this government, and time is running out. It has not gone unnoticed that we are spending a great deal of time and money to legalize this marijuana, but very little time and money on a public education campaign. An immediate public education plan is critical. And this Liberal government, they claim that they have committed $46 million to a plan, but I haven't seen it in my community, and I've talked to healthcare people in my community. They haven't seen a dime of that. Even your former Liberal cabinet minister and head of the task force on cannabis, the Honourable Anne McClellan, she said in committee, and I quote, "I think the most important part of prevention, which we have learned from tobacco, alcohol, and probably some other things, I might include gambling, is public education." That's the lesson you hear over and over again in states like Colorado and Washington. You have to have a robust public education, and you need it out of the box early, unquote. Not a single witness in committee advocated against an early and intense public education campaign, Mr. Speaker. So why is not this Liberal government starting now with this education campaign? Another serious concern, Mr. Speaker, that has been brought forward in committee and was brought forward in committee is the impact that this proposed legislation will have on Canada in the eyes of the world. We heard in committee that there are 3 UN, United Nations international treaties that are bound to violate, that we are bound to violate if this legislation is passed. We heard great testimony from Dr. Stephen Hoffman, who is a professor of law at the prestigious Osgood Hall Law School, and he is also an expert in international law. And he is very concerned, as are we Conservatives concerned, that this Bill 45 would in fact violate international laws. The United Nations Convention Against Illicit Traffic in Narcotic Drugs and Psychotropic Substances of 1988 is one of the 3 major UN drug control treaties currently in force that we as a nation have signed on to and committed to. This particular treaty provides additional legal mechanisms for enforcing the 1961 Single Convention on Narcotic Drugs and the 1971 Convention on Psychotropic Substances, which is to limit exclusively to medical and scientific purposes the production, manufacture, export, import, distribution of, trade in, use, and possession of drugs. With the passing of this Bill C-45, Mr. Speaker, these 3 international UN agreements will put us in contravention. And this Liberal government has failed to tell us and has failed to tell Canadians, how will you handle this situation? Tell us, how are you going to handle this situation? You refuse to. And as Dr. Hoffman said, and I quote, "I really would love to emphasize that the consequences actually are quite severe in the sense that it's not just our reputation, it's not just Canada standing on the global international scene. If we violate international law, we are actually undermining the best mechanism we have to get countries to work together and solve some of the biggest challenges we face in this world." One only needs to think about examples like serious issues of chemical weapons, or North Korea testing nuclear weapons, or even closer to home, the United Nations imposing illegal trade barriers against softwood lumber. Canada wants to be in a position that we are able to rely on our fellow countries, our partners around the world, to follow these rules that make Canadians safer, that make Canadian businesses prosper, yet it is very difficult for Canada to be taking moral stances on international laws if Canada is also violating them, unquote. So to close, Mr. Speaker, I would like to quickly summarize, although I think I have 20 seconds. I will just put it at the end here and say, Mr. Speaker, that we are not ready as a nation to rush into marijuana legalization, and the consequences will be severe. So thank you.
Questions and comments? The honourable member for Whitby.
Oh, thank you, Mr. Speaker, and I appreciate my honourable colleague's speech, and I appreciate his concern for education. And we're taking a public safety approach to with Bill C-45, $240 million to support law enforcement to detect and deter drug-impaired driving, $161 million invested in training frontline officers, another $81 million for provinces and territories, and a $46 million public awareness campaign. Does he not agree that this is a comprehensive approach to providing education and training?
Honourable member for Calgary Confederation.
Well, I'd like to thank the honourable member for your questions and your comments. I welcome the investment because we need it. Law enforcement needs it. They've told us in committee that they need the time, not the money. Of course they need the money, but they need the time, and they don't have enough time. July 1st is 8 months away, and they have clearly indicated to us, the Canadian Chief of Police Associations, the numerous associations around the country have said that thank you for the money, but we need the time. Thank you.
Questions and comments. The honourable member for, I'm sorry, let me just make sure I get the right one. Saskatoon Grasswood. My apologies.
That's fine. Thank you, Mr. Speaker. I want to commend the honourable member from Calgary Confederation for all the work that he has done on this. He has been a shining star in our party and the Health Committee for a couple of years. This is a very, very serious situation facing Canadians in the next 8 months. I was a trustee for 10 years. There has been no dialogue by this government. This government has not reached out to the Canadian School Boards Association. They haven't reached out to one province or territory dealing with how are you going to deal with 12-year-olds in school bringing 5 grams in their pocket. They haven't reached out to the Teachers Association in this country. And yet we're 8 months away. Their answer is simple, Mr. Speaker. We're going to throw some money on it and you decide. There is no game plan over there. So to the honourable member from Calgary Confederation, thank you for bringing this up. And education is first and foremost. How do you think this government should deal with it other than throwing money, which is 2 years too late at it?
The honourable member for Calgary Confederation.
Well, I'd like to thank the honourable member from Saskatoon Grasswood for his kind comments. Much appreciative. I am very passionate about this issue, that is for sure, as many of us are here in this House. I have a background in education. My family run a private school in Calgary, the Weber Academy, with over 1,000 children in our schools. And we care about these children. We care about informing them and educating them and telling them all about the harmful effects of marijuana. Yet, it's not happening in our school system. It's not in our curriculum. If it is, it's not enough. This public education plan that we need should have happened a year ago. Should have happened 2 years ago in anticipation of this bill being passed on July 1st. It's too late. By the time they legislate this bill into place, there will be marijuana on the streets with uneducated children throughout the country, unaware of the harmful effects of this drug.
Questions and